Good morning or good afternoon whenever you all are watching this video. My name is Sierra Gibson. I'm a CFI with Cumberland River Behavioral, and today we are starting a series that I wanted to start implementing. These will be psychoeducation classes for parents or staff members of schools, whoever really wants to be involved in this. So the psychoeducation is in partnership with what we call treatment planning. So whenever we're treating a child, we want to make sure that we're giving the most robust and accurate treatments that we can. And that also involves kind of a multidimensional treatment plan. So, I can talk to your kid at school for an hour and we can make really good progress. But if these things that we talk about aren't carried on at home or in the classroom or in extracurricular activities, then it makes it harder to see a change. And also, this is really good information that I hope will be helpful to the parents, because there is a lot of information about every diagnosis that we see. And I want you all to feel confident, because I want you all to be your child's biggest advocate. Yes, I will advocate for your child. I want what's best for them. I will try to go out of my way to get that for them. But I also want, if for some reason that I can't, I want you to feel comfortable stepping up to that. So this month we are talking about ADHD and me. So anytime that I tell a parent about an ADHD diagnosis, or whether they've gotten one from their primary care physician, we kind of see the deer in the headlights look of, this is a very big diagnosis. What does it mean? Well, where have I went wrong? What are we doing wrong? Why does my child have this? But before we ever even begin, I want to start this by saying ADHD is not a diagnosis given by misparenting or anything that the child has done wrong. It's just something that occurs. There's not really anyone to blame there. So what is ADHD? So ADHD is a neurodevelopmental disorder characterized by inattention or hyperactivity and impulsivity that we see messing with their day-to-day lives. So that's pretty common. A lot of us know that. So ADHD is attention deficit hyperactivity disorder, is what that acronym actually stands for. So ADHD affects about 17 million people of every age, gender, IQ, religion, and socioeconomic background across the US. So even if we really firmly believed, like what I mentioned in the beginning, that it was because of parenting or socioeconomic or whatever you believed there is so many different factors that play into everyone who's diagnosed. There is no common denominator. So the US Center for Disease Control and Prevention reports that about 8% of children will be diagnosed with ADHD. Boys are more than twice as likely to be diagnosed as girls. And we see this often because boys present, especially in younger ages, with more of the inattention and hyperactivity and impulsivity. When we look at girls who have ADHD who are much younger, we often see it, or especially in my experience, we see it kind of take shape in they're more perfectionist. They're very detail oriented. They hyper focus on certain things. And despite an overwhelming scientific evidence, there's still a lot of inaccurate information. And that's where a lot of this confusion comes from, about being misinformed, uninformed about what ADHD actually is. So ADHD and ADD, you'll hear those terms interchanged a lot, are actually one and the same. So ADHD stands for attention deficit hyperactivity disorder. ADD stands for attention deficit disorder. So the only difference is the hyperactivity. In the most recent DSM, which is the book that we use as clinicians to diagnose, they have actually termed everything under ADHD now. The DSM is a tool that we use as clinicians to make sure that we are looking for the same symptoms for each diagnosis. So whether you go to Australia or England or here in the US, we're all going to be looking for the same thing. And if you have a diagnosis and you go to any of those places, you're going to see the same symptoms that we see. But ADHD is highly manageable. It's very individualized. We can use multi-model treatment approaches, behavioral interventions, parent-teacher trainings, educational support, and medication. So we'll start from the beginning. How do you know what to look for? What are the signs that maybe you need to come and say, hey, Miss Sierra, I think my kid might have ADHD. So ADHD can present itself in a number of ways and can be broken down into 3 possible presentations. So we can have inattentive, hyperactive, impulsive, or combined. When we look at these, we want to kind of start looking at how long have they had it, how many symptoms have they had, and are these symptoms causing a problem in their day-to-day life? So are they falling behind in school? Are they having trouble making friends? Are they putting themselves in danger? So inattentive presents as fails to give close attention to detail, has difficulty keeping attention, does not appear to listen, struggles to follow directions, has difficulty with organization, avoids disliked tasks, requiring sustained mental effort, loses things, is easily distracted, and is forgetful in daily activities. Hyperactive impulsive often fidgets with hands or feet and squirms in chair, has difficulty remaining seated, runs about or climbs excessively, difficulty engaging in activities quietly, acts as if driven by a motor, talks excessively, blurts out answers, difficulty waiting or taking turns, interrupts or intrudes upon others. And combined, we see that often people with combined can have either the inattentive or hyperimpulsive symptoms. So oftentimes clinicians will be a little bit weary of diagnosing ADHD in very, very young kids. We want to see how they react in a school setting. We want to see how they react to routines and things like that. So ADHD in preschools often looks like dislikes or avoids activities that require paying attention for more than a minute or 2, often loses interest and starts doing something else after engaging in an activity for only a few seconds, talks a lot more and makes much more noise than the children of the same age, has trouble with motor skills like hopping on 1 foot by age 4, nearly always restless and, quote, must get up after being seated for only a few minutes, gets into dangerous situations because of fearlessness or warms up too quickly to strangers, frequently fights with playmates and has been expelled from preschool or daycare for aggression, often injured because of moving too fast or running when they're not supposed to be doing so. So once you know what you're looking for, then who do you talk to? So step 1 is realizing that there is a problem. Step 2 would be finding the appropriate professionals to help you go about this. So there are many, many healthcare professionals who can diagnose ADHD. Psychiatrists can diagnose, pediatricians, neurologists, psychologists, clinical social workers, nurse practitioners, and licensed counselors or therapists. However, only certain ones can prescribe medication and conduct tests. So nurse practitioners and physician assistants who are supervised for a physician. And as far as that testing goes, if you want your child to be tested for ADHD, a good avenue to go about is looking into a clinical psychologist. So this is for the parents. A lot of parents often get white coated. And what that means is not every clinician or professional that you meet takes into consideration that, this is a new diagnosis. You're not going to have all the information about it. And, a good professional realizes that. So here are some questions that you can ask. And I always encourage you to ask your professionals questions. They might not have the answer right in front of them, or they might not know it off the top of their head, but probably a good indicator that you have a good professional is they might say, I don't know yet, but I will find out. And they actually do find out and get back with you. So you can ask, have you diagnosed and treated many children or teens with ADHD? Have you received training in the diagnosis and treatment of ADHD? Well, what types of training? What kind of information will you need when you do an evaluation, and how long will it take? Do you screen for conditions that can also look like ADHD? That is a big one, especially in the mental health field. There are other diagnoses, not even just with ADHD, but any diagnosis. We want to make sure we rule out all possibilities. Do you screen for coexisting conditions as well? So with ADHD, children or even adults, anyone with ADHD really, are often more prone to anxiety and depression symptoms. So we want to make sure that we're not just saying, okay, well, they have anxiety and depression. We want to make sure that it's not tying into that ADHD. How do you usually treat ADHD? And for any treatments needed that you don't provide, can you recommend specialists who do? So with therapy and psychology, it is not a one-person field. There are many, many different avenues that you can go down, many, many different specialties, and the best therapy outcomes often involve a team of people. So I mentioned, how would they evaluate for ADHD? There is actually a standardized evaluation for looking for ADHD. So, okay, you've realized there's a problem, step 1. Step 2, you've found your professional. Now step 3, now we're going to evaluate the child. So when should I seek help and where do I start? So a child can be evaluated for ADHD at age 4, and parents should talk with the child's healthcare provider when they start to see symptoms causing difficulty. What is involved in a complete evaluation? We want to be sure that we find out whether a child has the kinds of symptoms that indicate ADHD. We want to understand whether they're severe enough to cause problems that require a diagnosis. Like I said, we want to rule out that there's no better conditions that represent the symptoms. And we want to understand if the child has more than one condition at the same time. So evaluating symptoms can be enough to get a diagnosis, but it's not enough to help get the right treatment. Evaluations will consider all possible causes for the behaviors. So, just because we see the symptoms and we see that there's a problem, we can give that diagnosis, but we want to be sure that we encourage the evaluations because we want to pinpoint exactly where the problem is happening. So evaluations will ask about the child's behavior at home, at school, in activities like sports or scouting, any other extracurriculars that they're in. And these can include things like interviewing the parent and child, reviewing family medical history, parent and teacher completed child behavioral rating scales. We often use like the Vanderbilt or the Connors are really good scales. Parent self-reports, parenting style, spending time with the child to observe their behaviors. So this could be maybe they come into the office, we can do classroom observations, kind of things like that. Clinic-based tests. This would be the standardized clinical psychologist testing. Review of earlier school and medical records, intelligence testing, educational achievement testing, or screening for learning disabilities if the child has poor grades. You know, we want to make sure that if there is a problem going on at school and we see it, that their grades are slipping, we want to make sure that not only are we treating the inattention and hyperactivity that is probably playing into that, we want to make sure they're not struggling with the work itself. So the results from the evaluations are used to create a treatment plan that is right for that specific child, including therapy and support at home, school, and other activities. So therapy is the first treatment option. So we have step 1, seeing that there's a problem. Step 2, we've found the professional. Step 3, we have done the evaluation. And step 4 is how are we going to treat it? So therapy is a critical part of the treatment for ADHD in children. According to the National Institute of Mental Health, many professional organizations agree that behaviorally oriented psychosocial treatments or behavioral therapy and stimulant medication have a solid base of scientific evidence demonstrating their effectiveness. And all that means is that was a really fancy sentence for things like CBT therapy and medication really work well with ADHD because we're treating the actual diagnosis with the medication, but then we're also teaching these coping skills. So when we meet with the child in schools, we have CBT therapy. That's our basis that we use. And what that means is it is cognitive behavioral therapy. And we implement what is called a therapy toolbox, or some kids call it a coping skills toolbox. And what that means is that we look at the symptoms that that child is having and we say, okay, maybe he gets really nervous when he has to take a test and he starts fidgeting and it's just downhill from there. Okay, so he would come in and I would say, okay, so let's practice taking some deep breaths. Or let's practice calming ourselves back down or grounding ourselves, bringing our focus back to what we were doing. If we see the impulsivity, one of the games that I like to do is red light, green light. And I think a lot of us remember this from childhood. So, you know, if we say red light, they stop, and green light, they go, and yellow light, they have to move very, very slowly like a sloth. And that helps them to, first of all, it gets their attention. It's something fun for them to do. But I explain that, okay, whenever you feel like you want to do something, let's think about the red light, green light game. So red light means stop. So we have to stop. A yellow light means think. So let's think about what we're going to do. Is it a good idea or is it a bad idea? Are we going to like the consequences or are we not? And green means go. So we're going to stop, think, and act. So those are just some very general ideas of what you get with CBT therapy. As far as treating ADHD in children, it often involves many medical, educational, and behavioral interventions that consist of parent and child educations about the diagnosis and treatment, behavioral management, medication, and school programming and supports. So research shows how a child with ADHD will do in adulthood is best predicted by these three things. So the first thing is whether his or her parents use effective parenting skills. So that could be things like if you say it, mean it. So if you tell them, if you jump on the couch again, you're going to have to sit in timeout for 5 minutes. Okay. So that means even if they are kicking and screaming and throwing a tantrum the whole way there, they're going to have to sit in that chair for 5 minutes. Another thing is routines. How structured is the household? So are they scrambling everywhere they turn? Are they forgetting their cleats for soccer practice and they're 10 minutes late getting out of bed in the morning? They've missed the bus. Or do they know exactly when things are going to happen? And do they know what's expected of them? Secondly, how he or she gets along with other children. So one of the big things that I try to teach is that we don't tolerate bullying. Even if we are having a bad day, we don't have to talk to people if we're having a bad day, but we can't take it out on them. So if that child's getting in trouble a lot that day and they are just going through it, we want to make sure that that diagnosis isn't causing kids to kind of shy away from them. And we also don't want the teachers to feel overwhelmed with that child. And I want to point out that that's not a reflection on either the teacher or the child. Like it is very hard. We are all human, whether people have ADHD diagnosis or not. Sometimes it's hard. We get frustrated with people. So one of the things that I try to encourage is we do what's called a reset. So if a child gets in trouble for something, whether they've had a complete meltdown or whether it's something minor that they're just very upset about, we talk about it. We ask, what went wrong? How were you feeling when this happened? And then we fix it. And I say we because we are a team with that child. Oftentimes, we know that these are very remedial things. We know that they will be okay. We know that the world will keep spinning. But at this time, that's the worst thing that this child has experienced. So they don't know these things yet. And so it's important that they know that we're there with them. So if a child decides to get mad and knock all their books off their desk, we can go in and we can pick the books up and then it's okay. We're not leaving them to figure things out by themselves. And then they get to press a little doorbell or anything with a little sound. And then we've reset. We've talked about it. We fixed it. We've apologized, whatever we need to do. And then after that sound, we're done with it. We know better for next time and we're moving on. And nobody's going to continue to be mad at them for that. It also measures or predicts his or her success in school. So just because they might have trouble learning in class, we want to make sure that they're not falling behind because of that. So we may need to monitor grades. We may need, one-on-one aids. They may need open seating options, whatever we can give them to help them keep up. So we also implement what is called behavioral modification, which is, like I said, the CBT. So with behavioral modification, parents, teachers, and children learn specific techniques and skills from a therapist or educator experienced in the approach that will help improve children's behaviors. Parents and teachers then use these skills in designated areas. So these we try to present as the ABCs. So we have antecedents, which is that's the things that set the problem. So that's their triggers. So maybe they don't want to sit and do their work for prolonged periods of time. The behavior is the thing that the child does that the parents or teachers want to change. So maybe they're up every 5 minutes when they're trying to do homework. And the consequences are the things that happen after the behavior. So they're up every 5 minutes, they're getting frustrated, you're getting frustrated, and then we end up just calling it a night on homework. So parents, teachers, and child interventions should be carried out at the same time to get the best results, which is exactly what we're doing here today. So this is the psychoeducation part where I tell you about the diagnosis, and later on in this, I'm going to give you some coping skills that you can use. So the 5 following points should be incorporated into these 3 areas. So start with goals that the child can achieve in small steps. And we want to make sure they're SMART goals. So we want to make sure that they are achievable. So we don't want to put that, the child will never have an outburst in class again. Okay, well, every child inevitably will have an outburst. We don't want to say that they'll never have an outburst in 2 weeks. Well, that's not a very manageable time frame. These changes are very slow because I don't know if you all have ever tried to stop a bad habit, but it's very hard. And you're reteaching a child how to think about something. So progress may be very small, and you have to really learn to enjoy the small wins. We want to be consistent across different times of the day, different settings, and different people. So going back to that, if you say it, mean it. That means whether you're the parent, whether you're the teacher, even me as the CFI, we want to hold them accountable for the things that we expect. Provide consequences immediately following the behavior. ADHD is a big diagnosis of out of sight, out of mind. And what that means is if it's not directly in front of you or directly in your line of attention, you're probably going to forget about it. And it's not an intentional action. It's just something that happens. So what that means is if that child has a very huge outburst at home, sit them down and explain to them, first of all, why that wasn't the correct action to take, and then provide the consequences and let them know. I mean, you can even reiterate, listen, this is why you're sitting in timeout, and this is for how long you're sitting in timeout. Implement behavioral interventions over the long haul, not just for a few months. So ADHD is kind of a lifestyle change. It holds the parents, it holds the child, it holds the teachers very responsible for keeping up these actions. So these routines, the scheduling, the consequences, we want to make sure that they stay there, or else these kids are going to slip back right into that same routine. Teaching and learning new skills takes time, and the child's improvement will be gradual, like I said earlier. So, numerous studies over the last 30 years have shown both medication and behavioral treatments are effective in improving ADHD symptoms. Combined treatments provide the best results in improving ADHD and oppositional symptoms, and in other areas of functioning, such as painting and academic success. So a lot of times I say, well, okay, we can look into medication. And the CBT therapy is a very holistic approach, which means that there's no medication involved. However, ADHD, like I said before, is a neurodevelopmental disorder, which means it affects parts of the brain. So, I, as the CFI, can make suggestions to them. I can try to help them focus, but sometimes they need a little bit more help. And medication does not have to be a long-term option. Sometimes medication can be something that we start as a way to settle the child. So, give them time to learn the coping skills, give them time to catch back up in class, give them time to kind of gain a sense of feeling a little bit more stable. I've often had kids come up and tell me when they have had diagnosis of ADHD that it's like there's bees in their brain, or there's ants in their brain. It kind of feels like there's a constant humming going on to them. And that's the way they know how to explain it. So a growing number of physicians believe that stimulant medication should not be used as the only intervention and should be combined with parent training and classroom behavioral interventions. I do want to say that medication and therapy should always be used together. It's in my personal opinion that I never want to give a child medication and think that that's going to fix everything. But in the end, each family has to make treatment and classroom decisions based on the available resources and what makes sense for that particular child. In the end, I'm not the child's parent. The teachers aren't the child's parent, and you all know your child the best. So we have to work with what makes sense and what makes sense for your child. So for preschoolers with ADHD, parent training and behavior management is recommended before considering medication. So with the child being so young, we want to make sure that at that age, they're a little bit more open to learning the skills. For children 6 and older, behavioral management in combination with medication and treatment is recommended. Some families may choose to try stimulant medications first, while others may be more comfortable beginning with behavioral therapy. When you first get the ADHD diagnosis, you don't have to feel like you have to jump straight into medication. We can start with these coping skills and we can see how the child does with them. Another option is to incorporate both approaches into the initial treatment plan. For young children with ADHD, behavioral approach is recommended first prior to considering medication. So like I said, if they're in preschool, we want to try the coping skills first. And I also want to point out that this therapy and medication would all be documented in a treatment plan. And the treatment plan is the clinician and the parent, and if the school is willing, even the school can sit down and say, these are the steps that we're going to take to treat this child. These are the resources that we can offer. But there's never going to be a treatment plan that is appropriate for everyone. Every child will have a different treatment plan, or they should, because no child has had the same 2 experiences. Every child will come from a different background. They will have different parents, different environments, different settings. And all of those things impact the way that they see things or how they interpret the world. And so we have to individualize the treatment plan that's best for them. So when you're looking at ADHD medication, I've actually included a chart that is approved by the US FDA. So these medications are listed in the chart. So let's see if this will actually take me here. Yes. Okay, so this is actually a list of every medication that is approved for ADHD by the FDA. So as you can see, there are quite a bit of them. And I strongly encourage parents to do their own research. You know, we are professionals, but again, you know your child, you know what you see. So look into the medications, see what you think, and then talk to your professional about it and say, hey, what about this one? Or what about this? And ADHD is any type of medication really, is a trial and error situation. Some kids we may get the right medication that works best for them right off the bat. But, sometimes they may not like that medicine, or we may have side effects, or we may not see the change that we're wanting to. So we may have to change it. We may change the dosage, but it takes about 6 to 8 weeks for that medicine for us to see that change. So it is a long haul process, but I promise the end result is worth it. We can also, so when you're doing your research, there's also a drug lookup app or application here. And so what this does, my computer's gonna load here. Anyways, there's usually a search bar here. There we go. So if I wanted to look up the diagnosis ADHD, then I can search. Okay, so all of these medications will treat ADHD. Let's see. Adderall is a very common one that we use. So this will actually take you to general information about the drug, the dosing information, duration effect, 8 to 12 hours, available forms like how many milligrams could be prescribed, monitoring, and safety information. So that is a really good tool for parents to use to research any type of medication. It's important with medication to make sure that if it is going to be given, that it's given at the correct times of day and consistently. So school nurses can give out medication during the school day and to make sure that children can take it during times that they're in school. It's just one sheet of paper. You come in, you fill it out. The nurse keeps the medication behind a locked cabinet or drawer, whatever it's locked. And then the child comes in there at their designated time and they can take it. Also, if your child has started medication, it should be monitored by a healthcare professional. And that's usually the prescribing physician. And only the healthcare professional should take the children off the medication. I would like to reiterate that. Only the healthcare professional should take the child off the medication. I will raise my hand over here. Sometimes I am notoriously bad for that. If I get prescribed a medication, even just in general, like if I go to the doctor and I have a cold and they give me medicine, sometimes it's hard to finish it to term. But especially with ADHD medication, there is a correct way to bring the child off the medicine. And we do that by decreasing the dosages to certain intervals. We do it by monitoring, and we do it gradually so that the dosage can be lowered until they're no longer taking it. And that is the safest option for the child. So parenting a child with ADHD. So we have seen that there's a problem. We have found the correct professionals. We have done the evaluation. We've treated it, or we're getting treatment. So now here's the parenting. So while ADHD is believed to be hereditary, effectively managing your child's symptoms can affect both the severity of the disorder and development of more severe problems over time. So I had mentioned before that oftentimes we see ADHD is accompanied by anxiety and depression. So we want to make sure that we're aware of that and that we aren't starting to see that. So here are some ways to get started. Don't waste your limited energy on self-blame. Like I said before, ADHD is not a disorder in certain areas, or ADHD is a disorder in certain areas of the brain and is inherited in the majority of cases. It is absolutely not caused by poor parenting or a chaotic home environment. Learn all that you can about ADHD. While a great deal of information is available on ADHD, not all of it is accurate or based on scientific evidence. When I was in college, a good rule of thumb is any type of government affiliated, so like the CDC, the National Institute, APA, those are all very good websites to get your information from because they are accurate and accredited. Make sure your child has a comprehensive assessment. To complete the diagnosis process, make sure your child has a comprehensive assessment. I see it quite a bit that I will get kids and they'll be like, oh yeah, my child has ADHD. And I'm like, okay, who prescribed it or who diagnosed it? And they tell me and I'm like, okay, well, did they have an evaluation? Like, can I get the ROIs to get that information? And ROI is just a release of information. And they tell me they haven't had an evaluation yet. So we want to make sure that we gather all that information so that we can best treat the child. So how do you help your child at school? So you become an effective case manager. Like I said, when we started this, I want you to be your child's biggest advocate. I want you to be able to walk into any professional's office and be like, listen, I know my child, I know this diagnosis, and this is what we need for them. Because like I said, I'm not your child's parent. The teacher's not your child's parent. You know your child. So keep a record of all the information about your child. This includes copies of report cards, teacher's notes, disciplinary reports, evaluations, and documents from any meetings that you've had concerning your child's prior treatments and placements. This could be like from IEP meetings or 504s. And contact information for the professionals who have worked for your child. So, like I said before about ROIs, whenever I have a child, I want to make sure that I have releases of information that I can work with that child's primary care physician. I want to be able to work with their pharmacy. I want to be able to work with their school and any other type of agency that I can pull in to give me information about that child. So we want to form a team that understands ADHD, and I want you as the parent to be the captain of that team. I am just an aid for you to use. So this is the most dreaded question that I get of all time. Homework help for ADHD. How many of you all have had your child and it's like 10 o'clock at night, you're still doing homework and you are just absolutely ready to bang your head into the table? It's okay. That is a valid feeling. And you are not doing anything wrong as a parent, and the child is not doing anything wrong on their part. Here's how we fix it. So before getting started, we want to make sure that your child has the supplies that they need to do homework. So this could be planners, daily checklists, folders, pens, pencils, etc. And we want to involve the child in setting up the space to help figure out what works best for him or her early in the school year. So we want to make sure that everything is in one area and they have everything they need. That way they're not getting up going, oh, I need this. Oh, I need to go get this. Oh, I need to go get this, because that's a very good excuse to get up and move around. We want to remove or minimize things that distract or cause stress. Position the desk or tables so they face away from doors or windows, and relocate the television. I don't expect you all to like actually pick up your television and move it. Just try to have a space where, you know, the child is not going to be daydreaming out the window or doors, and they're not going to be watching TV. If it's possible, find an open space or accessible room with good lighting. Although your child might like to do homework on the floor, have an uncluttered table or desk available, and it's a good idea. So kids with ADHD sometimes land in odd positions. Having open seating is a very good option for them. So maybe they don't sit in like a normal chair, maybe like a yoga ball, or it could be they have chairs that have, they look like desk chairs, but they've got a little rubber band on the ball or on the bottom of them. That keeps the child moving, but they can still focus. Use color-coded folders to remind your child what goes where. Create a folder for completed homework assignments that travel back and forth between home and school, and divide big assignments into smaller ones. People with ADHD are very prone to procrastination. So when there's a big task, if you can encourage the child to do a little bit at a time, it will be a very beneficial tool for them to have later in life. Also, like I mentioned earlier, the out of sight, out of mind, we want to make sure that they have a very stable organizational system. So with the color-coded folders, they know, okay, maybe blue folder comes home, red folder is done. Help your child read the homework directions. Use colored pens or highlighters to highlight the main parts, questions, and instructions, and write down any important information so it can be easily accessed. People with ADHD often are prone to forgetting what they read because they read so quickly. So taking time to encourage them, or you helping them highlight the question, makes it easier for them to go back and forth between what they're doing and what they've already read. Set up a consistent time for your child to do homework. It's important to establish routines and expectations. If you all take nothing else away from this, please, please, please set a routine for your child. People with ADHD absolutely strive to have routines, and they excel when they have routines. So you can use a timer to manage attention and to help your child stay on task. Schedule short breaks for 5 to 10 minutes and encourage your child to move during these breaks. So back to the routines. When you all create a routine, it helps to work backwards. So identify the time your child needs to be out the door in the mornings, or the time that they need to be in bed in the afternoons. Create 2 lists, one for tasks before and one for tasks after school. Estimate about how long it'll take the child, and plan backwards from the time your child needs to be out the door or in bed. Also, add in safety nets for that. Plan for extra bumps, add a little extra time for breathing room, because you don't want to be stressed about trying to make sure you're following it to the minute. Anything that they can do to prepare ahead of time. So they can do as many tasks as possible the night or weekend before. So they can take their showers the night before, choose clothes, prepare breakfast, pack a backpack, pack a sports and activity bag, and prepare the lunch or landing pad. Launch or landing pad. For the afternoons, again, you want to prep ahead. So you want to clean off the launch or landing pad. And what that means is if you have kids that come in, or when they go out to sports or school, that's kind of like the dumping ground. or it's where they hang their backpack or where their shoes are, but everything is in a general location. Have a homework space set up with all materials and create a visual reminder of after school rules. Check time along the way. So break up longer time periods, use a timer or alarm to set increments for each activity, and you can use apps. There are a ton of apps that will actually help with ADHD symptoms and help with organization. You can also ask your child for input. Involve your child in any of the routines that you create and ask them how long they think will take them to do things. The more you can involve the child, the more likely they are to do it. It kind of goes back to that very old parenting style of we'll make them think that it was their idea. So when you have your routines, they should look something like this. So this could be your morning routine, something very similar. So you have 15 minutes to wake up, 15 minutes to shower, 15 minutes to get dressed, 15 minutes for breakfast, an extra 15 minutes for brush teeth, fix hair, makeup, whatever. You have 15 minutes of flexible time, and then you're out the door in the next 15. As far as after school, this is just a very broad example of what it would look like if you had an extracurricular. And I know a lot of these kids are managing more than one thing at a time. So we've started down here with bedtime, and then we're just going to make our way up. So maybe they have baseball practice at 3:30 on Tuesday, and then they also have it at 5:30 on Thursday. We're going to schedule in the things that we know are there, and then we will work around it. But I hope that you all have found this at least a little bit helpful. If you all have any other questions or anything else that you want further information about, let me know. Like I said, every kid will be different. You know your child, you know what works for them. Use me, use your other resources, and be your child's biggest advocate. That's the biggest thing that I could tell you. So I hope you all have enjoyed this and learned something. And I thank you all again for being here.